Genetic home testing is a great health assessment diagnostic tool that can be used to help us to be aware that we might be predisposed to certain health care conditions. Genetic testing looks for changes, sometimes called mutations or variants in your DNA. Although genes can considerably influence health, they are just one piece of the puzzle. Other factors such as diet, exercise, and family medical histories are equally important. These healthcare conditions are predisposed to or based on our family history or genetic makeup. Type 2 diabetes is associated with advancing age, um, obesity, um, family history of diabetes, history of gestational diabetes, impaired glucose metabolism. Um, these are just some of the factors: physical inactivity, cultural, like blacks, Latinos, Native American, Asians, Native Hawaiians, and other Pacific Islanders are in particularly at higher risks for type 2 diabetes and its complications. Keep in mind, genetic testing is um, just to make us aware that we might be predisposed to certain health conditions. In your case, it says that you are predisposed to type 2 diabetes. It might not mean that you do have diabetes. The first thing I recommend, though, is I would set up an appointment with your healthcare provider to have a physical, which includes a blood test panel to test your A1C levels. The A1C level test measures of your blood glucose for the past 2 or 3 months. This test will help you to indicate your glucose levels on an average of 3 months. And if your A1C shows 6.5% or greater indication, this is an indication that you do have diabetes, possibly have diabetes. The, the provider of care might order you to have a FPG test, which means fasting plasma glucose test. This testing will require you to fast for about 8 hours with nothing to eat or drink except water. When you do have the FPG test, the normal level will show about 100. Pre-diabetes will indicate anywhere from 100 to 125, and anything equal to 126 or higher is considered diabetic. Another testing you might be asked to do is what we call an oral glucose tolerance test. This test is a 2-hour test which will check your blood glucose levels before and after you drink a glucose sweet drink. And it tells the doctor how your body processes sugars. In this test, diabetes is diagnosed if at 2 hours your blood glucose is equal or greater than 200. Um, an additional exam your healthcare provider might have to do is a plasma glucose test. This test is done anytime, it can be done any time of the day when you have experienced severe diabetic symptoms, for example, frequent urination, especially at night, very thirsty. You could be unexpected loss of weight, feeling very hungry, blurred vision, numbness, tingling in the hands, feeling very tired, dryness of the skin. It will also help you to understand if you have a family history of type 2 diabetes. Having a history is one risk factor of type 2 diabetes, and most healthcare professionals will ask you this question, so it will be helpful to know. Diabetes can be treated with diet and exercise and monitoring your glucose level. If diet and exercise does not work, the doctor may prescribe oral medication or insulins that will have to be injected to help you manage your glucose levels. It is also helpful to that you are avoiding sugary foods, but knowing what foods can affect your glucose level in a negative way is important. Carbohydrates are a key player in affecting our glucose level, and understanding what types of foods to eat is helpful. The key point if you are predisposed to diabetes, shown in your genetic testing, but have not been diagnosed with diabetes, you should try to follow a healthy diet and exercise regime, what helps with other common disease, comorbidities, such as heart disease. Staying healthy is a key way to prevent diabetes. An appointment with a nutritionist might be helpful to point you to the right types of diet you can follow and enjoy. And getting a personal trainer to get you started on fun exercise programs can be helpful. Walking is also helpful. General diabetes can be a scary diagnosis to hear, but it is manageable, and there are a lot of ways to manage it. There are even numerous low glucose foods that you can eat and aid in following a healthy diet.